So some doctors may have some hesitation on using NSAIDs in practice. I think many are very comfortable with it in young patients after surgery, but there may be some occasions where someone has had a bad experience, or a patient may have had an adverse event that was unexpected or difficult to deal with, that may cause the practitioner to not really want to use it long term or much at all. And what I'd like to say to those folks is that there's lots of data that exists that helps answer the question about long-term use of nonsteroidal anti-inflammatory drugs, especially in osteoarthritic patients. There's actually evidence that shows that the longer you give these products to a patient, the greater the efficacy is seen. Over time, from 30 days to 60 days to 120 days, the improvements in mobility and other activities that the patient has in their daily life improve significantly over time. At the same time, there's not an increased risk for adverse events that may occur. In fact, in most cases, if there's going to be an adverse event related to a nonsteroidal anti-inflammatory drug, it's typically within that first 14 days or so, up to a month, of that patient being on the drug. Over time, that doesn't necessarily increase. And in fact, Zoetis published data several years ago from their pharmacovigilance program that showed the incidence rates of gastrointestinal side effects and other reported adverse events to be quite low over the total period of time of patients being dosed.